Okay, so you are live now.
Okay.
Okay, we should start. I think it's Samnichi. Hang on, let me just check. Let me just remind Samnichi join technically. Huh? She's about to join, so you can get started.
Okay. Well, I'll introduce myself. My name is Dr. Raj Mehta. I'm a family physician, and I'm delighted today to be talking to all of you about hypertension or high blood pressure. I believe this will be done in two parts. Today, I'm just going to be talking about hypertension itself as a disease, what can cause it, and then tomorrow, I'm going to go a little bit more into how we manage hypertension as physicians, which involves medications and non-medication options. Uh, at any time during this presentation, please feel free to ask questions if you have clarifications. This is meant to be engaging and interactive. So the more I get to talk with you guys, the better this goes. Um, so my first slide here, I like this picture a lot. This is a picture of hypertension in the center, and it's got the classic kind of Venn diagrams, different things that can cause hypertension. So on the right, you have genetics. On the left, top left, you have environment, and then their kind of interaction. And I like this because, hypertension is not one disease with one cause or one etiology, as we say. It's multifactorial. There's a lot of things that can contribute to this. Um, and it has a lot of factors that can think about it. Let's get started. So first, I'll begin with the most basic question. What is blood pressure? We talk about this all the time, your blood pressure. And what does it mean and why is it so important for us to measure this? So the first thing I'll say is that we have a cardiovascular system and we have a system how blood flows inside of our body. And the idea is that our heart beats, it pushes blood out through the arteries to different parts of the body. And I think most of us have a basic understanding of why that's important because blood carries many nutrients. The most important is probably oxygen to the rest of our body. So our body has metabolized those things and has energy to function and so on. So in the late 1800s, we discovered that we could actually measure how strong the flow of blood is when it goes to the arteries. And in physics terms, when you have a tube and you have flow through that, you can create pressure. So that can be water in a pipe, or it can be blood flow through an artery. And the more force there is going through that artery with the blood, the more pressure it puts on the blood vessels. Okay? Now, it turns out that it's not a continuous flow. It's uh, our heart beats, right? It's not like a machine, like a turbine continuously pushing blood through. We have a heartbeat. And so every time the heart beats, it pushes blood in and then it relaxes. More blood flows into it and then it beats again, right? And so because there is a heartbeat, there's actually two phases to blood flowing through our arteries. There's a systolic, we call it, which is when the heart is contracting and it beats and pushes blood out. And the diastolic, when the heart relaxes, the kind of the force comes down. And so we measure blood pressure. We're kind of measuring the pressure of these two phases as blood flows through our bodies. The top number, we usually write it, is a systolic blood pressure. So how high the pressure is when our heart's beating. And then the bottom number is our diastolic blood pressure, which is what the pressure is when the heart relaxes. And that's how we write it. Systolic over diastolic. Any questions? Okay. So when we are measuring blood pressure, um, it's a continuous scale, it's a number. And most people, if we measure blood pressure of everyone here in this Zoom meeting, or if I took a measure of everyone that lives in Orlando and everyone in Florida or everyone in the US and the world, I could measure a lot of different blood pressures, and then I could use statistics and averages to figure out what's an average blood pressure. And so the classic average blood pressure is 120 over 80. Now, at some point, as your blood pressure gets higher, we know it can start causing problems for one's health. And so the American Heart Association and most major guidelines, whether they're the US or international guidelines, have created cutoffs that define when your blood pressure is too high. Okay? And so they've created different categories to kind of make this easier to think about. So this is the classification for the American Heart Association. This is what we use here in the US, but it's consistent with the European guidelines and a lot of WHO and international guidelines. So first of all, anything below a systolic of 130 or diastolic of 80 is considered normal. Okay, so anything in the 120s, your systolic, diastolic in the 70s, perfectly normal blood pressure. Then we get to this category of if your blood pressure is over 130 systolic, but under 140, so 130 to 139 range, or if your diastolic is the 80 to 89 range. This is considered high normal, okay? Meaning that it's not ideal, but we don't consider it hypertension per se. You're in kind of this high normal range. Okay. And usually anyone in the high normal range is when we as doctors start saying we should start trying to work on lowering it. This is higher than what we want. We want your blood pressure to be less than 130 over 80. If it's above 130, it's kind of too high and we should try and bring it down. Now, ideally we can bring it down with non-medication options, but we do what we need to do. And then the old system, we used to say 140 to 159 was grade 1. That's 90 to 99. And 160 or above or 100 above was grade 2. So that was kind of measuring how your blood pressure gets higher. Now, the AHA actually released new guidelines, and they've changed this a little bit. And so for some people, they'll actually even say 130 is grade 1. And that kind of depends on your doctor and your goal, because what we now do is we try to individualize this. So we don't want to have one threshold for everyone. We recognize some people, given other health concerns, we might want to have tighter blood pressure, and some individuals who are healthier and younger, we might be more relaxed. We not might be as focused and things like that. But this is kind of the historical blood pressure classification that we've always traditionally used. Any questions there?
One quick question.
Yeah.
Some people have like tendency to have low blood pressure, which is normal too, right? Like 90 to 100
Yes, this is a
systolic.
very important point. When I say 120 over 80 is the average, that means you can have numbers
Mhm.
above and below that. So if
Okay.
your blood pressure is 100 or 95 over 60, that's still within the range of normal, and we usually don't worry about it. Now, there is a point where if your blood pressure is too low, or your blood pressure drops when you're sitting and standing, or you find low blood pressure associated with dizziness, things like that, that's a different issue. And then that in those situations, low blood pressure also needs to be evaluated. Um, and it's a different conversation. But those are things, if you have symptoms, definitely need to be evaluated. But for most people, if your systolic is 90 or above and you have no symptoms, perfectly safe, perfectly within the normal range.
Got it. Thanks.
Any other questions? Okay. So traditionally, 140/90 is considered high blood pressure. I will say that, the newer guidelines even say 130/80. So I've written 140/90 here, but really if your blood pressure is above 130/80, it's still high normal. It's still worth trying to lower it. Okay. Now, why do we care about the blood pressure getting so high? Whether it's 140, 150, 160, what's our concern here? And the concern is that if the blood pressure is too high, it increases our risk for having health problems, increases our risk of heart disease, kidney disease, and strokes. And statistically, if you start measuring blood pressure in the US, almost 1 in 4 Americans have high blood pressure. And the biggest problem here is that most people don't even realize they have high blood pressure because usually there's no warning signs or symptoms. It used to be called the silent killer because unless you measured it, you would have no idea your blood pressure was high. And people historically could go years and years, decades with high blood pressure, causing all kinds of problems to their hearts, their kidneys, their brain, and not realize it till it's too late, till they had something bad happen. So being able to recognize, screen for this early, and treat it even when you don't have symptoms is really important. Another interesting point here, someone once asked me, they said, well, Raj, if there's more blood flowing through my arteries and they're pushing more and more, isn't that good for my health? Don't I want there to be more blood in my body? If the pressure is going up, how is that a bad thing? And I said, well, it's kind of like a faucet, right? If you turn it on not enough, you don't have enough water coming out. But if you turn it too much and it pushes out too fast, they might spray everywhere and get everything wet, right? And so the same thing happens here. If your blood pressure is too high, what happens is that let's say I take the kidneys, right? The kidney is a very delicate organ. And so you have blood flowing through it, just like you have a faucet, water coming out. Now imagine I pressure up very, very high, so high the blood is flowing so fast, it's just splattering against the organ, it's spraying everywhere. Well, if it does that constantly, it can start causing damage to the kidney, even on the microvascular level. The high pressure starts causing problems. It's damaging the tissue around it. And you might think, well, a little bit of pressure might not make a difference, but it builds up over time, over years and years and years. So yes, in some sense, having enough blood flow to the whole body is a good thing, but when the pressure gets too high, it can start causing damage. And we know that some organs are very sensitive to that. The kidneys, the heart, and the brain are, and that kind of makes sense. The brain is, of course, the most important organ of the body, very delicate. If you just have pressure a little too high or too low, your brain's going to be sensitive to that. The kidneys are probably the second most delicate organ, so similarly there. And of course, the heart is the most essential organ because it helps everything pump. So it kind of makes sense why high blood pressures tends to pick out those organs first over others. Okay? And that's also one of the main reasons we want to treat high blood pressure. We want to prevent those organs from having uh, problems in the long run. Okay, so this is kind of saying the same thing again. So if we think about the heart, if your blood pressure is too high, right, it makes the heart work really, really hard, harder than it has to. It has to work against all that pressure. And it increases your risk of having heart disease. So heart disease is when you have cholesterol, and the medical term is atherosclerosis, form in the arteries. And you can see here in this picture in the bottom left, you have this yellow plaques form. So high cholesterol can do this, but high blood pressure can also accelerate this. It can cause more damage, and it makes it harder to heal, and you can get more heart disease. And then this is kind of showing you the normal heart on the left and the right. The higher blood pressure heart, things start getting thicker. It has more damage, has to do more, it gets tired earlier. The other thing I forgot to mention was the eyes. So high blood pressure also associated with vision issues because, of course, the eyes are very sensitive to any kind of little pressure changes. And again, these are the main areas. So you think about the brain, blood vessels there can cause stroke from high blood pressure, vision, blindness is common, and the heart increases the heart attack risk and heart failure. So it actually can affect the heart in two different ways. One way is that it can cause those cholesterol plaques to form. that can cause a heart attack. The other way is that when you have very high blood pressure for a long time, the heart starts getting tired because it has to do so much more work, and you can develop heart failure. And both those things can happen separately or at the same time. So it's actually can affect the heart in more way than one. And then of course it can affect the kidneys there that we can see. So any questions there?
Yes. So what's
Yeah.
the difference between heart attack and heart failure?
Excellent. Okay. So a heart attack, this is what happens is that the blood flow in the heart, you see there's the blood vessels there that supply blood to the heart. So in a heart attack, what happens is that the blood flow through the arteries gets blocked. It's almost like if there's a pipe and there's water flowing through it, suddenly something gets plugged in that, something gets caught, and the water stops flowing. So in a heart attack, what happens is that the blood vessel in the arteries, some damage happens, and it suddenly forms a plaque or it gets closed off. And when it gets closed off, blood can't flow through it anymore. Okay. So if you imagine the heart here, if suddenly this major artery it collapses and there's no blood flowing through it, then the whole part of the heart down here won't get any blood flow. If it's not getting any blood flow, it doesn't get any oxygen. And after several seconds to a minute, the tissue will start dying, start having collapsing, and you'll start getting massive chest pain. So that's a heart attack. Literally, blood flow to the heart is being cut off because of these plaques forming and stopping the blood flow. And that's a major event that caused you to have chest pain. Now, heart failure is a different issue, and there's many things that can cause heart failure, but the idea of heart failure is that your heart is a pump. And like with any pump, it works with force. It pushes blood out of the heart. So a strong heart will have like a strong clap, will have good flow. But if you have a lot of problems affecting the heart. And in this particular case with high blood pressure, it puts a lot of strain on the heart because the heart really has to push hard to really get that blood to flow. And over years and years and years, it starts getting thicker. It starts getting more stiff. It's not as flexible. It gets stiffer, more stiff, and it has a harder time pressing together. And so normally where it could maybe get 70, 80% of the blood out every time it pumps, now maybe it's only getting 20% of the blood out. It's less efficient. And so because it can't get the blood out fast enough, if you try to do any activities like run or jog, you get tired very quickly. And so that's heart failure. So it's not something that happens suddenly like a heart attack, but over many years, your heart gets weaker and you're not able to do as much activity or do as many things.
Okay.
Does that kind of explain the difference a little bit?
Yes, thank you.
My pleasure.
One quick thing, what is cardiac arrest?
So cardiac arrest is the same thing as a heart attack. So heart
Okay.
attack is a lay term. The medical term for it is a myocardial infarction. Myocardial is Latin for heart tissue, and infarction is a Latin term from tissue dying from not having enough oxygen. And so there's a lot of ways you can say that. You can say a cardiac attack, uh, plaque, all kinds of terms. But it's the same principle. The mechanistically, it's the same thing. Blood flow to the heart is stopping for some reason, and without blood to the heart, the tissue dies, and it's a very sudden thing that happens in minutes. And it's not part of this talk, but actually in modern medicine, we can now put stents in and do a cath. So if you have a heart attack, but we can get you to a hospital within 30 minutes and they can diagnose it and put a stent in and reopen the blood flow to the artery, we can get blood back into your heart and reverse a lot of these things. And so one of the amazing things about modern medicine is that if we work quickly enough, we can reverse some of these things, but prevention is still better than ending up in the hospital and having to get these procedures done.
Sure. Thank you
Um,
very much.
My pleasure. Any other questions?
And so hypertension is an umbrella term for all these conditions.
Hypertension can cause these things. It's a risk factor for these things developing. So the goal of treating or preventing hypertension is going to prevent these things from happening. So when you have hypertension affecting the blood vessels and the arteries, it can increase your risk of a heart attack. When you have hypertension causing strain on the heart over many years and decades, increases your risk of heart failure. When you have hypertension untreated, over time, it increases your risk of stroke, blindness, all these kind of things.
Mm-hmm.
So we know from data that if you have high blood pressure, the risk of these things go up, and the risk goes up almost exponentially the higher your blood pressure is.
Mm-hmm. Okay.
Any other questions? Okay. So these are just some slides talking about how blood pressure affects different organs. So the brain, hypertension is probably the most important risk factor for a stroke. So for anyone that has a family history of stroke or worries about it, the most important way we can reduce strokes from happening is good blood pressure control. So very, very important. This is the heart. So I've mentioned this before, but one thing is that hypertension can increase the risk of a heart attack. And that's when you have these plaques or blood clots or things stopping blood flow and causing a heart attack and tissue in the heart to not get enough blood and start dying. And then the opposite, a parallel thing to that is over many years and decades, if the heart works too hard and gets weaker over time, you can develop heart failure, which is what that picture on the bottom right shows. Kidneys is a big concern because if you have too high blood pressure, it starts damaging the kidneys, and as the kidneys stop working well, it takes more and more work to try and filter all the impurities out of your blood, and it has less blood flow, and it's not as good as doing that, and waste products start building up, and then you can start going into kidney failure. And then the eyes, this is perhaps the biggest one. There's a lot of things that can cause issues with the eyes. Certainly, if you've had a talk on diabetes or high blood sugar or high sugars, that's a big one. But high blood pressure is a major cause of vision problems. You know, the eyes are very delicate, very sensitive organs, especially the back of the eye, the retina, which is important for receiving all the light images that we can't see for vision. There's very sensitive blood vessels there. And over time, if you have high blood pressure, the retina and the blood vessels start getting damaged, and it really affects our vision, more blurry, difficulty seeing, things like that. Um, and in terms of the blood vessels themselves, so the blood vessels, I describe them as pipes, right? That's my analogy. Blood flowing through an artery is like water flowing through a pipe. But the reality is that blood vessels in the body are living tissue. They're not simple pipes, right? And they're like with any tissue, they can be damaged, they change over time, they can heal, or they can get damaged. And so if you have high blood pressure for many, many years, our blood vessels, which are normally a little bit softer and have the ability to kind of be pliable and flexible, they become stiffer, they become more diseased. Sometimes you can get plaques that we can see in this picture here, and it's shown in the yellow. Sometimes you can get calcium deposits, so more calcium deposits there, and they get much stiffer. And so these are other problems that can happen in our blood vessels over time. Okay, so I've mentioned the problems that hypertension can cause in the body. Now I want to switch gears and I'll talk about what are the things that cause our blood pressure to go up. And so some of these are things we can change and some are things we can't change. So the number one thing that relates to high blood pressure is actually age. Unfortunately, I have no magical cure for age, but we do know as the body gets older and it just normally ages, the aging process does cause the vessels in our body to become a little bit stiffer, and naturally the blood pressure can get higher. Okay? And most of my patients who have high blood pressures, you know, are above the age of 50 because that's when you really start seeing a lot of these things come in. Race is mentioned there, and not so much race in terms of, you know, what your ethnic background is, but race in terms of genetics. You know, there are genetics that cause blood pressure to be higher, and that if your family members, if your parents, other people in your family have high blood pressure, you're more likely to have genes that can cause high blood pressure. Okay. Some of those can be like really strong genes, and some of them can be weaker polygenic, so it can skip generations, but it can still be a strong part of that. Obesity, so if you're more overweight, that can be a risk factor for it. Inactivity, so if you're not active, you're not exercising, that can be a huge part of it. And even walking or doing yoga can be something that can really reverse a lot of that. Smoking is a huge cause of high blood pressure, probably one of the biggest things you can stop to prevent it. And then some dietary things. So the more sodium you have, the more likely you have high blood pressure. And alcohol intake can also contribute to that. So poor diet. So that's the idea is if you have too much salt, high cholesterol, diabetes, kidney disease. One thing we don't talk about enough is sleep. Sleep is a huge part of high blood pressure. A lot of people who don't get enough sleep or have sleep problems. And there are specific issues with something called sleep apnea or obstructive sleep apnea. And that's actually one of the more subtle causes of high blood pressure. A lot of my patients can have high blood pressure and they don't sleep well. They feel tired a lot during the day and they snore at night when they sleep. And many of them turn out to have sleep apnea. And when we treat the sleep apnea, their sleep gets better and a lot of their blood pressure issues resolve because the blood pressure issues were actually from the sleep apnea and snoring at nighttime. And once you treated that properly, then the normal blood pressure during the day became normal. And then excessive working. So I don't want to tell anyone not to work, but we know stress and a lot of work can contribute to blood pressure going higher. Any questions there at all? Okay, so I want to talk a little bit about how we measure blood pressure. So the most important thing is that you need a good blood pressure cuff. So I always recommend blood pressure cuffs that go over the arm. I don't recommend wrist ones because the wrist ones are not as accurate. So try and get a cuff that goes over the arm. Okay, a lot of them are automatic battery operated. Those are perfectly fine. When you measure your blood pressure, you always want to do 2 readings. So you want to do 1 reading and 2 readings. You can average them, but 2 readings make it more accurate. If you have multiple readings of your blood pressure being high, that can be a concern of high blood pressure. Before you measure your blood pressure, don't drink tea or coffee or smoke for 30 minutes before. If you have a cup of chai and you try to measure your blood pressure 15 minutes later, that caffeine is going to cause the blood pressure to go up. Okay. Um, activity makes your blood pressure go up. So you want to make sure you're sitting down and resting for 4 or 5 minutes. If you go to the gym, you go for a walk, it's normal for blood pressure to go up. Okay. Our blood pressure is not static. If you're exercising, the blood pressure should go up and that's normal. When we're talking about hypertension, I'm talking about your resting blood pressure. When you're relaxed and you're at home and you're not active and you haven't had any caffeine, what is your resting blood pressure at? And that hopefully is normal, but if that's too high, then that's the concern. When you measure your blood pressure, you don't want your arm to be too high or too low. You want it to kind of be level with where your heart is. Some people, I'm going to stand up. They put their blood pressure and they put their arm all the way down here by their waist. And you can do that, but you kind of want it to be resting on a table and you want it to be kind of level with where your heart is ideally. Okay. And don't hold your hand up when you're measuring your blood pressure because if you hold your hand up, your muscles will tighten and your blood pressure will be falsely elevated. You want your arm to be relaxed, so it has to be lying on a table of some kind. Okay. So they mentioned get 2 readings and average them when you measure blood pressure at home. I always like to tell people to try and read it twice a day if you want to monitor your blood pressure and then write it down. So if you're writing it down, we can keep track of it. And then you can review it with your doctor or your nurse to see how you're doing. It's always great to go to the bathroom before you check your blood pressure. If your bladder's full, that can cause your blood pressure to go up a little bit. Okay. The American Heart Association has a high blood pressure calculator, so you can go there. You can use their calculator to put your blood pressure in and your age and other factors, and it'll kind of tell you where you are in terms of your healthy range. So it's really nice that resource is free and available. So tomorrow, as I mentioned, I'm going to talk a little bit more about how we treat blood pressure, but here I do want to talk about how can we prevent high blood pressure, because prevention is so important. And I have kids, so a lot of times I try to instill them in healthy habits. So as they get older, if they have these habits, they'll be better for their long-term health too. So one, healthy eating patterns. So we don't want to overeat. We also don't want to have diets that are too high in salt. Number 2, maintaining a healthy weight. And number 3, being physically active. So that's really important. That's not necessarily having to play sports, but any kind of activity, any exercise, anything that you do. Number 4, limiting alcohol. And number 5, not smoking. So probably the biggest things we can do. Then a healthy diet, people ask, what does that mean? That can usually mean 1 serving of veggies, 1 or 2 servings of fruit, 4 to 5 servings of nuts, seeds, and beans, less oil, right? Less carbohydrates, less things that are not quite as healthy. And then, a healthy diet for prevention is reducing sodium. So you want to be careful because a lot of processed foods you buy, a lot of canned foods from the store will have lots of salt in them. And then, anything salt-free, anything vegetarian, plant-based is excellent. And then you can look at weight charts. The way we classically discuss weight is something called BMI, body mass index. So based on what your height is and your gender, you can look in your chart what's considered a safe weight. And a BMI, a value above 30, means that that's probably an area where you can try and lose weight and reverse it. So there are scales based on your age, your height, and your gender about where your weight should be, and you kind of want to follow those as best you can to keep the blood pressure rating low. Physical activity is really important. We always like to recommend 30 minutes a day of moderate level activity. So this is going to get your heart rate up to 130. So 30 minutes a day, it doesn't have to be every day. You could do an hour every other day. You could, in theory, 30 minutes a day over 1 week is 210 minutes. You could, in theory, just do it all on Saturday and Sunday. 60 minutes one day, 120 the next day, kind of work it that way. So it doesn't matter how it happens, but 30 minutes average daily, if you can get that through the course of a week, that's really great. Anything family oriented. Examples are using a stair instead of an elevator, walking when you can, and so on. Limiting alcohol intake. I think hopefully this is self-evident. Not smoking. And that's my talk. So I think I'm good on 8:30. Questions I can take. Again.
So Dr. Raj, when you say it's reversible, hypertension is reversible, the plaque, the deposits in the arteries, cholesterol, fatty deposits and all that, they can be reversed?
They absolutely can be reversed. Now, what I will say is that hypertension can be preventable and reversible. Every person is different. So for some people, reversible means I can eat healthier, I can lose weight. For other people, reversible means I might need to give them medicines, right? But the main point stands that if we talk about something like heart disease, coronary artery disease, where there are plaques in the blood vessels, we know with a lot of excellent clinical data that if we do all the right things, like keep our blood pressure low, keep our cholesterol low, eat healthy, lose weight, that is 100% reversible. Now, it's hard sometimes for people to do all the right things, but it's very, very convincing that it can do that. And I've seen it. I've seen patients who've had heart problems and become very healthy, take all the right medicines, and go run a half marathon, even though they had a heart attack a year ago. So absolutely, with modern medicines and with the right diet and the right lifestyle, these things are reversible for many people. Again, I have to specify every patient is different. In some people's situations, I don't want to make too broad a generalization, but yeah, for sure, hypertension is definitely preventable, and a lot of the things that hypertension can cause are reversible. Right?
Dr. Raj, quick question. If you don't take enough water during the day, does your blood pressure go up or?
That's a great question. So, water intake by itself doesn't have a huge effect on blood pressure. And I say that because water and salt in the body are very closely correlated. So in our body, um, the idea is that the volume of fluids in our body is a production of both the water amount and the salt amount. And so what happens in our body is that the kidneys will be very careful to filter both our water amount and our salt amount. Okay. And so if we drink a lot of water and it's too much water, the kidneys can just make sure it gets out because they can balance it very easily. And if we don't drink enough water, the kidneys will hold on to the water if we need it. So our kidneys are very good at regulating water. The problem is the salt, because the kidneys have a harder time regulating salt. And what happens is that if you have too much salt in your body, then the kidneys has to start changing how much water it keeps or excretes to make up for that salt. So when we talk about reducing the salt in our diet, although we're talking about salt, that salt is indirectly affecting our water balance as well. And so trying to reduce unnecessary salts isn't just about the salt, it's also about balancing the water. And you can try and drink more water or less water, but if you're not reducing the salt, it's not going to make a difference because your body still has to figure out what to do with all that extra salt. Does that kind of make sense, I hope?
Yes, yes, yes.
Yeah.
Thank you.
Yes, of course.
Hey Raj, you may have touched on this, but people think I have a headache, my blood pressure's up, or they have these symptoms they blame on blood pressure. What are your thoughts on that?
So definitely, if your blood pressure does go high enough, it can cause symptoms. And for many people, they can be sensitive to it. Many people, if the blood pressure gets 15, 20 points high, they might get headaches or other symptoms. The challenge is that that's not a universal thing, right? One person out of 10 might have symptoms, but 9 out of 10, their blood pressure could reach 180 and they might not even notice it. So I can't rely on symptoms alone to tell me if I have high blood pressure. If I'm a person that's sensitive to high blood pressure, that I get headaches from it, very important to make note of that. And then you have to be extra careful at maintaining it. But not everyone's going to have symptoms. The majority of people don't. And that's why you can't rely on it. That's why you have to measure your blood pressure to see where you're at. I also want to be careful because headaches can be a very challenging thing. And although high blood pressure can trigger them, for many people, there might be other things going on. Like, I sometimes get migraines. And if I have high blood pressure, I'm saying this hypothetically, that might trigger a migraine. That's maybe why I feel it more often than not. But in that situation, not only do I want to keep my blood pressure low, I also need to make sure I talk to my doctor about managing my migraines, let's say, and so on. Any other questions? Well, I'm excited to talk tomorrow because this is the basics, but there's a lot of excellent data on different aspects of exercise, yoga, meditation, and the positive effects it can have on blood pressure. So I think that would be really great, and I'm looking forward to having that talk with everyone.
Dr. Raj, what happens if we run or have, during physical activity, that run for some time and our, heart beats faster? So is that
Yes.
simulating high blood pressure?
Great question. So one of the things that I always like to tell people is that your blood pressure going up and down is a normal thing and a good thing. So if I'm running and my heart rate goes up and my blood pressure goes up, that's what I want to happen. If I go to the gym and I'm lifting weights, my blood pressure goes up, that's appropriate. That's physiologic, okay? A physiologic increase in my heart rate or my blood pressure to meet the demands of my activity, to meet the demands of exercise is a healthy and a good thing, okay? So physiologic meaning normal reflex and the blood pressure going up and the heart rate going up is a good and healthy thing if it's trying to help us do the activity we're doing. When I talk about hypertension, what I'm talking about is not the normal response to me exercising. It's if there's some other problem that causes my blood pressure to be high when it should be normal. Okay. If I'm running, my blood pressure is high, great. But if I'm sitting on my house comfortably relaxed, and not doing any activity, my blood pressure should come back down, right? And my blood pressure is not coming down, that's a problem. If I'm sleeping at night at bed, my blood pressure shouldn't be as high as when I'm running outside, right? So that's what we're looking for. We're looking for abnormal high blood pressure when it should be normal, okay? And when that happens, then we worry because if your blood pressure is high, even when you're sleeping, even when you're resting, then over many years that can cause problems, right? But if your blood pressure goes up for 30 minutes when you're exercising and comes down as normal for the other 20 hours of your day, that's not going to cause you any health issues, right? In fact, it's a healthy thing because exercising can cause a lot of other positive benefits to the body.
What
So no, we go
sorry.
ahead.
What if a person has hypertension and is exercising hard?
Well, if you have hypertension, you're exercising hard. Um, it's a couple caveats. So one is that if you've been diagnosed with hypertension, but it's being treated, if you're taking medicines, if you are doing strategies to lower your blood pressure with diet and your blood pressure is controlled, then you should absolutely exercise. And for most people that have hypertension, if they exercise more and they are exercising more vigorously, in the long run, it will help bring down their blood pressure. Okay. So that goes without saying. If you're exercising very vigorously and you start developing symptoms, you start feeling chest pain, lightheaded, then you should, of course, stop. And that's true regardless if you have hypertension or not. So having high blood pressure doesn't mean you shouldn't exercise. It's absolutely safe to exercise as long as your symptoms are free. So if someone has high blood pressure and they come ask you, can I still do yoga? Yes, absolutely. If you start having lightheadedness, start having chest pain, start having symptoms, then stop. But it's absolutely safe for you to do any kind of those kinds of activities. You should still see your doctor and get your hypertension treated or figure out what's going on. Right? Does that kind of answer your question?
Yeah, I was just curious, with hypertension, for example, my blood pressure is already high, and then I'm exercising on top of that. So I'm increasing my blood pressure even more.
That is true. The way to think of hypertension is that hypertension is not so much about the damage it does to you right in the moment. It's the damage that accumulates over years and years and years, right? So I worry about your blood pressure being high 20 hours out of the day, 8 when you're sleeping, 6 when you're sitting. I don't worry about your blood pressure being high 30 minutes or an hour when you're exercising, right? That's the issue. Does that hopefully put it in context?
Yep. Yeah, it does. Thank you.
Any other questions? That's a great question because a lot of people with high blood pressure are afraid to exercise. So they think exercise will make their blood pressure go up. And yes, physiologically, it will temporarily go up, but in the long run, the exercise is excellent. It actually will, long run, help the body become healthier. So you really want to encourage exercise done in a good way. Yeah. Anyone else? All right, I guess I'll wrap up then. Thank you so much.
Okay. Dr. Raj, I would like to know about the varicose problem. There is also some problem of blood circulation.
Yes, so this is a slightly different problem. So high blood pressure talks about blood flow in the arteries. So I stopped sharing this picture. I probably should bring it back up. But blood flow in the arteries is blood that goes out from the heart to the body. Okay. Now there's a second vascular system, which is the veins. That discusses the blood being returned to the body. And that's usually depicted as blue veins and blue vessels. So sometimes you can have problems in the veins with the blood coming back. And so in some individuals, they can get things like varicose veins. So for example, the veins in the legs or the arms can become very wide, dilated, and more visible, and so on. And that can cause sometimes problems for individuals. It's different from hypertension because hypertension is more about the blood flowing out from the heart, not so much as the blood returning. Generally, issues with the veins and varicose veins usually don't cause health problems the same way high blood pressure does. Usually it can happen because of aging and things like that, but we oftentimes don't have to do a lot because for various reasons, issues in the veins don't affect the body the same way that the arterial blood flow does. And so in most of my patients, if I do see varicose veins and things like that, oftentimes they won't have any symptoms and we generally don't have to do a lot for it. But there are times when it can cause health issues, and then, of course, we have to figure out what to do. So,
Okay, thank you very much.
yeah.
So, I think all have asked whatever is to be asked. Okay, so thank you, Dr. Raj. You have already given so many instructions, and you have talked about the lifestyle. So that is a really very important factor which causes sometimes problems and health issues. So that is very crucial thing which everybody has to pay attention to that. And there are certain pranayam also which we have already discussed how we can control the blood pressure, high blood pressure or low blood pressure. So that has also been discussed. So yes, you have said very well about the problem, medical view about the problem of hypertension. So thank you very much for coming and giving talk. Dr. Raj is there?
Yes, sorry, I had my microphone on mute. Thank you so much,
Okay.
Samniji. I was glad to be here.
Yes. So you are in
Thank you,
Orlando, is it?
Sorry, what was that?
You are in Orlando, right?
Yes, I'm here in Orlando. Yes.
Okay, okay. So thank you very much, Dr. Raj,
Thank you, Samniji.
for your wonderful talk. Now it is the session for the meditation. All are ready? So meditation can also help us to control the blood pressure. When our mind is in peace, automatically our body systems work in a proper way. So blood pressure, if it is high, it can go down and we can be in peace. So right now we have to practice some meditation. Anybody is ready to give us some session? On who is ready? Anybody? Shivani? This video is great. So sit in comfortable posture. If somebody is ready to give session, she and he can be welcome. Otherwise, I can start giving session. So sit in the comfortable posture and just I'm shutting the door. Meditation करवा रही इससे. So with sit in comfortable posture with a straight backbone and neck. Close your eyes softly. With 5 Om sounds, we will start our meditation. Since the Om sound, you have to make at your places, but if I speak, it will not be audible through Zoom. So you can do 5 times Om sound. Om. 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 Relax. Relax your entire body, mind, and vocal cords. make a resolution. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. The first step of meditation is Kayotsal, relaxation with self-awareness. Concentrate your mind on the big toe of your right foot. Starting from the toe up to the head, see each and every organ, giving auto-suggestion to be relaxed. Relax all the muscles, bones, tissues, cells of your body and let it become limp. Concentrate on each part of the body one by one. Allow each part to relax by the process of auto-suggestion and feel that it has relaxed. Experience that the whole body is completely relaxing. The whole body is completely relaxed. Retain the relaxed condition throughout the meditation session. Simultaneously experience keen awareness of your own self, distinctly apart from the body, and maintain the awareness. Besides being a pre-meditation exercise, Kaiser is an excellent remedy for hypertension and a direct antidote to other psychosomatic diseases resulting from stress. Since today we have discussed about the hypertension, it would be better for us to go into deep relaxation. The second important meditation or step of meditation is perception of breathing, which is also very important for calming down and thereby to control the hypertension. Now concentrate your mind on the tip of your nose. Direct full attention to your breathing, excluding all thoughts and sensations. Regulate your breathing. Make it slow, deep, and rhythmic. Focus your consciousness on the navel and become fully aware of the contraction and expansion of the abdomen, accompanying exhalation and inhalation, respectively. Continue the perception of navel region for about few seconds and experience that the breath has been regulated to a slow rhythm. Continuing the slow, deep, and rhythmic breathing, shift your attention from the navel and focus it inside the nostril. Inside the nostrils. At the junction where the two nostrils meet, let the perception of breathing fill your entire mind. Be fully aware of each and every breath. Fix your consciousness totally on the process of respiration so that each and every inhalation and exhalation is perceived. Do not permit yourself to be distracted. But if distraction does occur, return. Do not try to calmly until it goes away. Maintain the continuity of awareness of the breath throughout the session. Now we will focus on alternative breathing. For optimum health conditions called homeostasis, a balanced equilibrium in our breathing system must be maintained. For a practitioner of meditation, the technique of alternative breathing and its perception is not only a valuable means of maintaining homeostasis, but also an instrument of studying and controlling the wandering mind. Now you have to concentrate on the alternative breathing. If you require, you can put the thumb against your right nostril and your ring finger against your left. Your middle and index fingers touch your forehead lightly. Decide upon a suitable rhythm of exhalation and inhalation, say for 6 and 4 seconds, and maintain it throughout the exercise. Close your right nostril by your thumb. Inhale slowly and silently through your left nostril for 4 seconds. At the end of the inhalation, close the left nostril, release your right nostril, and exhale slowly through it for 6 seconds. At the end of the exhalation, and without pausing, begin to inhale through the right nostril, the same one which was used for exhalation. Inhale slowly for 4 seconds. Now close the right nostril and release the left one and exhale slowly through the left nostril for 6 seconds. Reach the first round as original starting point is reached. Without interruption, repeat and perform the exercise for several rounds. Silent as possible. Try to maintain a rhythm without actually counting. Remember that the use of the fingers is temporary, and ultimately you have to use your willpower to alternate the nostrils. Throughout the exercise, your consciousness must be coupled with your breath. That is, your attention will go inside with inhalation and come out with exhalation. Total concentration of the breath is essential for this exercise. Perception of alternative breathing. Breathe in through right, breathe out through left, breathe in through left, and breathe out through right. Take 4 seconds for breathing in and 6 seconds for breathing out. Now with 2 Om sounds, we will conclude the meditation. Before, you can take 2 long and deep breaths. Feeling that your body is becoming active. With 2 Om sounds, conclude the meditation. Om. Om. Now rub both the hands. Keep them on eyes and open your eyes gently.
Naminam Sami Samriji. Very good
Hmm.
meditation.
Thank you.
Vandaminam Samisham.
Yes. Very good instructions have been given in the manual. So just we have to focus on them.
Maybe if you name the people, they'll do it. Somebody just pick a person, they'll do it, So next time.
Yes. Yes. Just you can keep the book and it is very good instructions, very clear instructions. So thank you very much.
Samniji, which book is that, Samniji?
The manual which is given to everybody. And this is what
All right.
white one.
Sure.
Yes.
I'll try it tomorrow, Samniji.
Yes. Okay, so thank
Vandaminam
you.
Sami Samniji.
Naminam Sami.
Thank you.